No.
Welcome everyone that's joining. We're waiting a few more minutes just to wait for the rest of our attendees to come in. For those of you who are just joining, we will be starting in 2 minutes. All right, we are ready to start. Welcome everyone. My name is Valerie Guyan, COO at CCD Health, a GEPS healthcare company. We appreciate you joining us today for this live webinar session, Improving Patient Access to Care Through Effective Scheduling. So if you're joining us today, You know that appointment scheduling presents not only logistical challenges, but also significant financial considerations for all healthcare organizations. Understanding and addressing the actual cost is crucial for unlocking growth opportunities, for improving operational efficiency, and enhancing that patient satisfaction. We can all agree that by optimizing this appointment scheduling process, centers can actually increase productivity, reduce costs, and deliver consumer grade patient experiences. In this session that you will see today, we will dive into the true financial costs of those appointment scheduling challenges, which is very interesting. And we will showcase how innovations in healthcare systems can be leveraged to transform access and care journey. Before we start, let's do a little bit of housekeeping. So, if you're experiencing any issues with your Zoom audio or video, please make sure to refresh your browser or your app, and that should take care of it. Remember that all of your questions are welcome. Feel free to drop them on the chat. I will be looking out for them, and we will have a Q&A session at the very end. So today we have the pleasure of having two very special guests here with us from the healthcare and patient access industry. We have Lillian McCann. Lillian has led operations, collaborator across HR, business development, quality, training, and a bunch of different teams to execute strategic goals for over 20 years. At CCD, she handles contact centers operations for top US healthcare centers, focusing on reducing that turnover that it's a headache for all of us, while integrating state-of-the-art technologies. Welcome, Lil. Thank you for being with us.
Thanks, Valerie, for that warm introduction. Pleasure being here.
So our second guest is Edison Sepulveda. Edison is an accomplished executive and chartered financial analyst with over 16 years of experience in consultant and corporate roles, as well as private equity. Before joining CCD, he worked as a consultant in EY. And right now at CCD Health, Edison leads our innovation team, unlocking value through groundbreaking projects. Welcome, Edison. I think you're muted, Ed.
Apologies. Thank you, Val. Looking forward to sharing some insightful information with our audience today.
Thank you both for making the time to be here. So let's take a moment to go over the agenda that we have prepared for everyone. Our guests will go over the real cost of ineffective appointment scheduling, optimize scheduling models to improve access, implementing new scheduling systems, measuring the impact of scheduling changes, special consideration for specialty care access, and then that Q&A session at the end. Without further ado, let's dive into the topic today. Edison, Lillian, I'll hand it over to you.
Thanks, Valerie, again for the warm introduction, and I want to thank everyone that's joining us today. In order to start, I'd like to start with a brief summary of CCD Health, a GEBS healthcare company, and the fact that we are a leading patient care for healthcare and radiology appointment setting in the United States. To state a little bit more of who we are, we cater to 750 different locations distributed in 15 states. We have more than 10 years experience in the appointment setting arena, scheduling more than 4 million appointments per year out of 2 main locations in the Dominican Republic. What makes us stand out above other healthcare delivery centers is our focus on workforce management. Our operational improvements. We're always looking for ways to develop new innovative solutions, always thinking about our partners' overall facility efficiencies. We're also backing our information by data-driven insights so that your center as well as us can make informed decisions on these items. We are a member, an active member of RBMA. We're also HIPAA compliant as well as PCI compliant. Moving along, when we review what counts in an ineffective scheduling system or different items, obviously it could be costing more than what we think. And some of the main factors that are most likely impacting these are the supply demand imbalance. It could be hidden costs in different areas, such as staffing, training, and other KPIs that need to be measured, as well as data analytics for any type of demand forecasting that could come across. And to start getting into the hardier part of this presentation or our conversation, I'm going to pass it along to Edison so he can talk to us about some of those supply demand imbalances.
Thank you, Lil. One of the key trends that we've been seeing over the last 5 years, as all of us that are involved in the healthcare industry have seen, is that a ever increasing, ever expanding gap between the supply of personnel, especially clinical, but also administrative personnel for healthcare center, and then the demand for that type of personnel. So, and even though scheduling is often overlooked, this could prove to be a costly mistake just because it can help you not only minimize the impact of the financial costs associated with paying these personnel, but also that opportunity cost, because once you don't have the personnel necessary to serve all of your patient interactions, what that means is that you might leave some appointments on the table or not perform some procedures or studies or even consultations, and that could prove to be significant amount of dollars for your healthcare centers, for your operation. So what we'll be discussing today is how you can structure an effective program that minimizes the impact of what you see on the screen, which is that ever increasing gap that ever since the pandemic, ever for the last 4 or 5 years, we've seen. And moving on to the next slide, a couple of the strategies that we're going to be discussing today. It's you're going to see periods, and all of us in healthcare understand that there's significant seasonality across the year, across the month, and even intra-week or intra-day. And you see peaks where you have high demand, where you have relatively limited supply. And then you have others where you have high supply. You have too many people to serve the amount of interactions for the volume of patients that are coming your way. So how do you deal with those? We're going to discuss some strategies that you can pursue. But here, just to give you a quick glance, quick summary, in periods of high demand, low supply, what you want to do is maximize efficiency, right? Dynamic booking, how you can properly forecast so you can make sure that you're hitting your targets. And by hitting our targets, we're not saying just any arbitrary targets, but also using some data-driven analysis to understand what are those targets that you need to hit. That's what we mean by optimal. And then when there is a low demand but high supply, what you want to do is try to minimize the financial cost, the financial impact of that high supply that you have. And then there's the smart overbooking, or just so that you can optimize your scheduling operations in the most efficient manner. This is basically what we're going to be touching on throughout the presentation, and I'll pass it back to Lillian so that he can touch on some interesting pieces.
Thanks, Ed. As Edison just mentioned, supply imbalance has a direct impact on the centers. And when we think about one of the main topics of these impacts, it's staffing. Overstaffing can drain resources. It could also inflate the cost. When we think about understaffing, it could lead to burnout on the resources that are working in the scheduling queues for these centers, and therefore have an additional cost of hiring that we may not want to face at the moment. You know, it compromises the service quality and obviously the patient experience. When we're designing a staffing model, we always want to think about staffing at around a 3% abandonment ratio. And we've noticed in the past that patients will actually hold up to about 45 seconds in the queue. Anything after that would be would impact the quality of service, as mentioned. Another cost and efficient system is sometimes training. Ensuring that we have clear standard operation procedures for the different types of scheduling modalities is imperative for the organization. We also like to see if implementing designs of some self-paced curriculums could also be implemented in order to streamline that training, or having some type of knowledge spaces as well that the resources could turn to if in case they need it during their moments of training and or operation. Lack of training obviously impacts key indicators because it trickles down to the expertise that the resources have that could increase, for example, average handle time or even first call resolution. That again impacts patient experience and could lead to less potential referrals if these lack of experiences or possible complaints get to the referring doctors that most of the centers do count on to get new volume in. A well-oiled training framework is key to any team's success in the day-to-day. Once we're aware of these costs and the different areas that it impacts, there are some simple items that could be critical to the successes, and we'd like to move on and implement some of the scheduling models that could assist. These scheduling models can lead up to a 20% increase in operational efficiencies, and the three top models that we like to talk about are open access, same-day scheduling, and workflow optimization. When we refer to open access or advanced access, it's usually a model that places the scheduling of the appointment in the hands of the patient. You could usually do this with a patient portal or any type of other automated service. These would be for appointments usually to be scheduled within 24 hours or 48 hours ahead, not necessarily same day, but it gives that patient the flexibility to own part of the process. The other model that we also recommend is the same-day scheduling model. The same-day scheduling model is usually ideal for lower modalities, simple type of tests such as basic ultrasounds, x-rays, screening mammograms could also qualify as a same-day scheduling service. Usually what these do is that they will reduce the likelihood of any missed appointments or any delayed care that needs to be provided during the time. So therefore optimizing as well the usage of the equipment in the areas. Another model that we always like to recommend and talk about is also the workflow optimization model. This one does require a little more TLC as it includes reviewing and refining different steps of the patient journey. Usually we want to see everything from the appointment scheduling all the way through the digital records segments or pieces. And the goal for this process is to enhance the experience while we review all of the different data points and we remove through thoughtful consideration any steps that could hinder the natural flow of the process, again, from the whole journey, from the appointment setting to the check-in all the way to the billing processes. So any lean capabilities that could be implemented for those would be ideal. Moving along, when we talk about implementation, another enhancement strategy is to think about possibly a new scheduling system. Embracing this can target significant organizational change. And there's two focus areas to work on whenever we're thinking about implementing change. We have change management, and we also have to think about the culture that we have in our different centers and our different locations. Change management is tough and it takes time because it changes the way that things have always been done. Why do I need to adapt? Why do these how are these changes going to benefit me, for example? So that's why these come hand in hand with the culture of adaptability, because it creates high geared communications and it adapts the workforce so that less resistance could be presented when wanting to implement any type of new scheduling system. So if we think about some of the barriers that these could bring, we have to address them when we're implementing any type of change. And we have to look for ways that make these transitions smoother. So again, any type of technological change or system change can lead to resistance. And one of the factors that could relieve this is over communicating the reasons why. This is always going to be one of those key factors, especially when we're integrating our leadership team. Our leadership team needs to buy in to any of these changes. They need to be given the ability of empowerment to be part of the process. Sometimes we like to think about giving them enough empowerment that they have a little entrepreneurial gap and their creativity comes to float. And obviously, whenever we give them all of this access and all of this empowerment, we have to have the correct incentives in place as guardrails to ensure that everything is going in the right direction of the change that we want to implement. Obviously, looking towards continuous improvement is always going to be the main goal, and we want to look for any lean practices that could make your organization more agile and more responsive to any of your center's needs. I'm going to go ahead and hand it off to Edison, and he's going to talk about this journey that we're seeing now.
Yeah, thank you, Lilian. And Lilian touched on something very important, which is systems. You want to implement systems, obviously, in 2024. This is technology is a critical component of any operations in any industry, any business, really. Especially in healthcare now, we're seeing a lot of trends to drive that technological development and technological implementation. But one of the things that we always say, you shouldn't organize or technify the chaos. You should first think process, and then you should think technology. And when we're talking patient access and specifically scheduling, we want to have a very holistic view of your whole workflow, your whole operations. And this is a very simplified view of what you'll typically see at either an outpatient center or even an in-hospital setting, where from the time the order is generated or the patient decides to visit the center, until the whole revenue cycle management process happens. And what we typically see here are some very important shortcomings, especially with some of the systems that are in place across the patient access spectrum. One of them is that it's very fragmented. So what you'll typically see at many healthcare centers is that they have one tool that is really good for appointment scheduling, but another one that might be really good for everything related to order processing, and then another one to process everything for the prior authorization. This creates a lot of problem because your operations are not as streamlined. Then most healthcare systems, and we've seen this across the board with many of even the large players, are not necessarily dedicating enough resources to what we call UI or UX, right? That user experience, because they're thinking patient and they're thinking how to be more efficient, which in healthcare is important. However, for our own employees' sake, we also want to make their life easier and provide with the right tools so that they can perform their jobs. But we haven't seen a lot of tools that actually address this. And then there's the inefficient allocation of the staff that you already have. And we touch on the supply and demand imbalances in all of healthcare, including clinical personnel, but also administrative personnel. And when this happens, and then you have inefficient allocation due to improper systems, then what that creates is more inefficiencies that are gonna, hamper and create some obstacles for your center. And when we say inefficient allocation, is that you cannot pull, for example, schedulers across different functions that you have just because you're either using different tools or because those are so complex, because they're so different that you need to specialize people in each individual function. And then there are issues with how you visualize things, how you visualize the data, which is a critical component. We always say you cannot manage what you cannot measure. But most of these systems won't allow you to really understand how are your scheduling operations going, how is it performing up to the agent level, to the specialist level, but also at a macro level by different functions. And then the lack of optimization, which is a key component that we've seen more and more interest from healthcare centers. You want to maximize whatever you have, be it the time of your doctors, the time of your machines, the time of your rooms, if it's a diagnostic lab, for example. You always try to maximize the time and the allocation of time. But most of these tools have not contemplated any feature to actually address this situation, address this need. So with that being said, what are the recommendations here from this point of view? What we typically want to see is that we go to the table when we're evaluating any tool, be it a new implementation or just a replacement. These 5 key components that you included as criteria for the selection of any system. And prior to that, you want to make sure that your process is already taking those into account, that you have an ideal process that once the system comes in, it can streamline a very efficient and very good, well-designed process. So this is a key recommendation here in regards to this patient journey design plus the tech enablement of said process. Moving on to the next slide. One of the things we want to quickly show you is in regards to that last piece that I mentioned, because we believe this is where healthcare is going. The drive for optimization, right? We always hear how healthcare is one of these industries that have a lot of slack, a lot of inefficiencies, and you want to keep always evolving, always optimizing. And one of the things that we've seen that for healthcare centers is critical for optimization from a scheduling point of view is those people who call into your center, schedule an appointment, and then never show up to set appointment. That's a huge drag on the financial performance of your business, but also in the access to care for all the patients in your patient base. So one of the things that at CCD we have discussed and we have actually worked on, it's what we call the no-show predictive model, how we can address the situation specifically. And what the no-show does is that it tells you out of your whole appointment base, which appointments are more likely to no-show. And with that, you can undertake some pretty good strategies to minimize the impact of said no-shows. And what we've seen is that across healthcare centers of different specialties and all of that, what we've seen is that close to 38% of your no-shows are in the top 10% of your appointments, but you don't know what's that 10%. So with a tool like this or a feature like this, in case you want to implement it in one of your systems, you can pinpoint, okay, that 10% that really drive most of your no-shows. Moving on. Yeah. What we see then is that with some of these strategies, most of the healthcare centers are paying a lot of attention to what are the financial costs. This is just an example, but there are so many others. Like for example, what's the turnaround time for that order processing? And obviously we can spend days talking about RCM. However, what we've seen is that not enough time and not enough people is being dedicated to the missed revenue opportunity, that opportunity cost that you have due to patients who don't show up, or that you didn't have a doctor or adequate personnel to serve your volume of interactions, for example, or even to attend a patient that came in. So those things really drive significant financial outcomes once you address them for your business, for your company. And this is a quick example of how a relatively mid-size a healthcare operation, healthcare center, in this case, an outpatient center, could generate a ton of value in the orders of millions of dollars just by making a significant change in how they address their scheduling operations. Moving on with another example and this is specifically on abandonment rates. And Lilian already mentioned that usually you want to see between 1% and 3% abandonment rate. What we like to do is usually understand what are the financial implications of just increasing the amount of people that you have or you need to serve those interactions, just so that you can strike that right balance between having too many people and having too high of an abandonment. But what we've seen, and this is an interesting key point, is that 22%, close to 22% of the people that abandon your calls, that you didn't take their calls, usually, and this is especially true for outpatient, usually go to another center. We understand that patients, especially in this day and age, they have options. So this is a very, very deep study that we conducted, and we understood that abandoning a call is very costly for your center. So these are some of the things, again, that people are not paying enough attention, and overlooking these type of things is costly for any business, especially a business that might have, thin margins or that might be relatively small, mid-sized operations. With that being said, any new implementation obviously carries some risk and carries some cost, be it a process, be it a system. So you need to have in mind before you decide to undertake any new initiative, any new process, you need to have in mind what are the metrics that you want to impact. Especially in scheduling, there's a host of different metrics that you can select and you can prioritize. And here the keyword there, prioritize, because we believe that you cannot address all of the things at once. You need to prioritize and see, okay, what are the metrics that I really need to improve on? And what are the metrics that, based on my business strategy, my healthcare strategy, I'm going to be prioritizing? And what we've seen across of healthcare is that two broad categories of metrics are the key ones that you need to drive. Everything related to efficiency, especially how fast and how quick you churn that next appointment in scheduling, is key. And this is a combination on how fast you actually go through the process. Your specialist can go through the process of scheduling an appointment, but also how likely are they to convert those appointments? And as we mentioned, that abandonment rate, what's the optimal balance for you to strike? And the other is critical for most healthcare centers, right? Patient experience. What's the quality of the interactions that you're serving? How satisfied are those patients with those interactions, and even with your visit? So all in all, these are some of the key messages that we try to drive. Select one of these broad categories, 3 to 5 metrics that you want to try to optimize or satisfy across the spectrum, and then pursue relentlessly any new system or process design that will help you achieve those goals. With that being said, I'll pass it back to Lilian so that she can touch on some specialty items.
Thanks, Edison. Basically, to conclude, once we're creating that ideal journey. And once we're looking at all of the different factors that Edison and examples that Edison presented, we need to take considerations for the complex modalities. Obviously, any type of oncology related modality will require potentially different specialists, different equipment, longer time factors, different approvals throughout the process. So ensuring that available dates are prudent for these studies, and segues obviously will be key. Prioritizing these due to the impact that it has in the patient experience could also lead to an improved rate. Radiology scheduling is complex for small and large centers, so take the time you need and ensure that you're looking for the process improvement to manage and create a solid scheduling flow. Thank you very much, everyone. I'll pass it along to Valerie at this time.
Thank you, Lilium, and thank you both for such a great presentation. I think you both provided very actionable insights into the true financial costs associated with an effective scheduling. So we're ready to start our Q&A session. If you have a question that you want our team to answer, we're open to do it. This is the time. And I want to thank those of you who have already sent a few questions. So I'm going to go ahead and start with those. First question here. How can healthcare organization effectively balance the need for efficient appointment scheduling with maintaining high quality patient care experience?
I'll go ahead and take that one. So very good question, Valerie. You know, there's some modalities that require more time, as I mentioned before. So analyzing the workflow, streamlining this workflow, and implementing any type of Kaizen or other lean practice in the process will help. We need to account that these flows sometimes have special focus on patients. We need to know what the pain points are, what the concerns are in regards to certain steps of the process. So ensuring not only that the staffing demand and balance, as Edison mentioned early along in the presentation, is key, but also ensuring that the team has the proper empathy skills and the de-escalation training needed whenever patients are walking in the door. That also adds to a very successful practice. Not sure if there's any more questions out there.
Yes, we have a few more. Thank you, Lilium. So another question here is, could you elaborate on the role of data analytics in demand forecasting for appointment scheduling? I think you're muted, Ed.
Yeah.
Apologies. Yeah, I think I can take that one, Valerie. This is a great question because what we've seen is that healthcare is subject to a lot of variability across the year, across the month. We see seasonalities, we see peaks and valleys across different timeframes. And what we've seen works best to understanding how you can balance the right level of staffing with the right level of customer care, patient care, or your patient interactions is that you need to properly forecast what that volume of interactions is going to be throughout the month, throughout the year, throughout the week, and even throughout the day. And for that, not to get too technical, but a couple of things that we really like to use is some very advanced techniques like Sarima models and also something called long short-term memory, which is LSTM, which are some of these new age forecasting techniques using deep learning, machine learning, that can help you drive a relatively low deviation in your forecasting. And then armed with that information, you can properly staff, again, touching on that gap, that supply and demand imbalance, that you need to be very careful with how efficient you're going to be with the staff that is already in the doors.
Thank you, Edison. We have a question here regarding metrics. It says, what specific metrics or indicators should organizations prioritize in their analysis to optimize scheduling and resource allocation?
That's a very good question related to analytics as well. And I love that we have so many questions related to that. But basically, a couple of things that we always aim to do, as I mentioned already, is you cannot optimize 30, 50 metrics. Even systems that are leveraging artificial intelligence cannot do that. You cannot expect your managers, your leadership to be able to do so. So what you need to do is really focus on those 3 to 5 key metrics, KPIs that you really think will drive the most bang for the buck and the best outcomes for your company, for your healthcare center, your healthcare operations. Armed with that, we usually, especially for scheduling, what we like to do is separate it into 3 main buckets. It's productivity, efficiency, and quality. In terms of efficiency, we like to use a key metric that englobes most of the things that come into that, and that's basically the appointments per hour. So how frequently are we sharing in those appointments? This is a key one because it's kind of summarizes all of your efficient operations. For the patient interactions, there are so many that we can measure. Obviously, everything related to patient satisfaction is going to be a key component. But when you're going to measure patient satisfaction, you have to do it the right way, because you don't want, for example, to miscategorize bad interaction when it was really a bad system issue, or the patient had a bad visit to your center, or he didn't like the facilities that he visited. So you want to try to segregate as much as possible what's the source of that, that 1 star, 2 star that you're getting. And then for productivity, what we usually like to do is, how quickly are you turning around, for example, the orders that you're processing? And how many are you doing on a unit of time, an hour, a day, etc. That really can give you some insights into how many people you need to serve that volume of interactions.
Thank you, Edison. I think we have time for one more question. Here's one. In terms of implementing new scheduling systems, what are some common challenges that healthcare organization may encounter? And what strategies have proven successful in overcoming these barriers of adoption?
Thanks, Val. And I'll go ahead and take this one. So, change management is definitely one of the main challenges. People tend to resist to change. We don't like change. Why do we have to do it if everything is working? So again, working with the leadership team and the different stakeholders to give them buy-in, it comes to mind. We need to help them overcome any of the challenges that they may have with the change in regards to the culture. Having key stakeholders selected to participate in the process, giving them enough autonomy to implement and demonstrate problem-solving skills will be key. And finally, measuring what matters, as Edison said before, by putting in key incentives that are going to help you put those guardrails in place to make sure that what's being implemented is what needs to be implemented, and that's going to assist with your workflow going forward. So that comes to mind, Val, in regards to that one.
Thank you, Lilium. And like Ed said, yeah, it all goes down to measuring what matters here.
Exactly.
Yeah. Well, thank you both for answering this question. And to our audience, we hope that this exchange of ideas serves as a starting point for you in optimizing your patient processes. If you want to learn more about the optimized scheduling services that we do at CCD, please visit CCD Care, subscribe to our newsletter. And to everyone here, have a great rest of your day. Thank you for joining.
Thanks, everyone. Bye.
Thank you, everyone.